In this lecture, we continue our discussion of type 1 diabetes mellitus, and we're going to take a look at specifically risk factors and complications that arise in individuals afflicted with type 1 diabetes mellitus. And so one of the largest risk factors for a person developing type 1 diabetes mellitus is genetic susceptibility. And having family members that are afflicted with type 1 or type 2 diabetes mellitus are seen as risk factors. Now, these are statistical risk factors. This does not imply directly cause and effect, but these are statistical relations that those afflicted with type 1 diabetes mellitus do have a statistically higher level of a genetic link to this development. In terms of energy utilization metabolically in people with type 1 diabetes mellitus, this is particularly problematic because as long as glucose is circulating in the cardiovascular system and glucose is not able to get into the cells that will use glucose as a source of energy, the cells of the body essentially senses that the body is in a starvation state. And as a result, without glucose being burned for fuel inside the cells have no choice but to move and adapt to burning other fuels. One such fuel is fatty acid. And so without insulin, there's no inhibition of an enzyme called triacylglycerol lipase. This is an enzyme found within fat cells or adipocytes that when this enzyme is active, it will accelerate the breakdown of stored fatty acids inside these fat cells. And those fatty acids will leave the fat cells, will enter the cardiovascular system, get transported to cells, and will be used as a source of energy. Insulin functions to inhibit this enzyme. Therefore, with the presence of insulin, insulin has the effect of increasing the storage of fatty acids in these fat cells by inhibiting the breakdown of those fatty acids in the fat cells. But that will only continue for a certain period of time until the cells, particularly skeletal muscle cells, will start to break down muscle protein. The body will attempt to conserve this, but eventually in type 1 diabetes mellitus that is not managed effectively, or in an advanced case of type 1 diabetes mellitus, this will lead to muscle wasting. One of the reasons in which muscle protein is broken down inside muscle tissue is that most amino acids can be converted into new glucose molecules. That can happen inside the cell, but protein and the amino acids can be used directly as a source of energy. Nevertheless, that will lead to long-term muscle wasting. So some of the problems that accompany type 1 diabetes mellitus as driven by insulin deficiency is that the individuals so afflicted will see an increase in catecholamine, cortisol, and glucagon secretion. These are hormones released throughout the body by different organs that will have the effect of increasing and accelerating overall body metabolic rate. One of the items that gets increased is that there's an increase in lipolysis, or an increase in the breakdown of stored lipids in the body. One of the problems with an accelerated rate of fat breakdown and protein breakdown, as indicated on slide number 11, is that there's going to be an increase in the production of what are called keto acids. And keto acids are small 2-carbon molecules that are byproducts of fat and protein breakdown. And being acids, these small molecules will have the effect of decreasing overall body pH, or will increase the acidity level of bodily fluids. And in order to deal with that acidification of body fluids, that will lead to a small but chronic increase reflexively in respiration rate. So a person will start to increase their breathing rate faster, and these are referred to as Kussmaul respirations, and is seen as a form of hyperventilation that is a result from the body trying to manage this accelerated level of production of keto acids and an acidification of bodily fluids. Other more prominent complications include a chronic increase in blood pressure. Because glucose is trapped in the cardiovascular system chronically for a longer period of time, that adds solutes to blood. And as long as more solutes are added to blood, that will increase the pressure exerted by the blood on the interior of the cardiovascular system. Because more molecules are being filtered and reabsorbed, this does increase the workload on the renal tubules and can lead to, in the long term, kidney disease. Associated with number one, with a chronic increase in blood pressure, people afflicted with type 1 diabetes mellitus can experience peripheral vascular disease as well. In advanced cases of type 1 diabetes mellitus, blindness and peripheral neuropathies can result. And the reason this occurs is that the chronic increase in blood pressure applies a great deal of force and can damage very small blood vessels that will feed blood to peripheral neurons, as well as supporting the function of the eyes. And it's not uncommon for these vessels to experience these micro ruptures. And as long as those vessels are micro ruptured, support to the eyes and peripheral sensory neurons will be damaged. In a very extreme case, diabetic ketoacidosis, in a very severe form of hyperglycemia, can result when bodily pH decreases too much, and that can be a life-threatening situation. So, in a person that might be experiencing diabetic ketoacidosis, some of the symptoms that they would experience include nausea, vomiting, stomach pain, and the accumulation of the keto acids will yield a fruity type of breath as a telltale sign of the rapidly decreasing pH in those fluids. This is a critical set of symptoms to follow, because 2 to 5% of uncontrolled ketoacidosis are considered to be fatal. One of the techniques, or a common method, the hallmark method of managing type 1 diabetes mellitus, is providing an external or exogenous supply of insulin, since the person is not able to produce their own insulin. And so this is synthetic developed insulin. One brand name is Humulin, manufactured by Eli Lilly, and this comes in a variety of different dosages. Some of these insulin supplies are either short-term or termed rapid release, which can have an effect within a 4 to 12 hour period, or some are considered to be long-term, or termed slow release, which acts over a 24-hour period. Biosynthetic insulin is manufactured in petri dishes by E. coli bacteria. So E. coli bacteria have been cultured so as to produce this protein, which is captured and put into, as you can see in the bottom right-hand part of the slide, either in a pen or in a vial for injection. Supplying insulin exogenously in this case does require the monitoring of blood glucose throughout the day, because there are numerous factors that can affect blood glucose. So a person's eating pattern, which includes the number of meals and the quality of those meals. The quality referring to the type and amount of carbohydrate as part of those meals. If a person engages in physical activity or exercise, the quantity, how much they engage in, and the intensity of the exercise will determine the extent in which they rely on glucose as an energy supply. And what's important is the timing of all three factors in terms of eating, exercise, and providing the injections is critical for the effective management of type 1 diabetes mellitus. And Humalog is another brand name for a type of insulin that is considered to be a mealtime insulin. And it's very fast acting in response to a person consuming a meal. So this ends this video on some of the complications that arise with type 1 diabetes mellitus.